welcome to One to Set Anesthesia. Thanks for joining me today. I wanted to go over pediatric MRI anesthesia. I'm doing my children's rotation here at Children's Hospital of Los Angeles, and I thought it might be helpful for me to go over what to expect during your MRI day if you are assigned to an MRI room. First things first, obviously you get here in the morning and prep the room, which usually consists of getting the meds ready and knowing where all of your equipment is, getting familiar with how the anesthesia machine is here, knowing where your airway equipment is. Succinylcholine for potential laryngospasms, and then atropine for potential bradycardia. I will get my propofol stick ready. Also remembering MRI safety and not to bring anything that is metal into the MRI room. Here at CHLA, parent present inductions are the norm, and other places it might be different just because of staffing or the way that the MRI is set up. But here we allow parents to go back into the room with us. We have the parent hold the child, and we do like to give lidocaine before pushing the propofol because it burns, and that's what gets kids screaming on top of them already being nervous to go into the MRI scanner. We will give propofol induction. The doses, we start off with 2 mg per kilo, and then that's usually enough to have the child fall asleep. And once they are heavy and falling asleep, the parent will put them on the MRI table and say goodbye. Then we titrate in a little bit more to effect. Obviously, as anesthesia providers, we are most concerned with the airway. So once the patient is off to sleep and we are providing general anesthesia, we want to make sure that the head is positioned properly so that they are not obstructing. So position the head extended, make sure that they're able to breathe spontaneously, and then you can start the infusion after that. The starting infusion rate is usually 250 mg per kilo per minute, and we titrate that to effect as well. So when you drop the syringe in the morning, you want to draw up, if you want to know how much to have in the syringe pump so that you don't have to keep going back and forth, a good way to do that is multiply the multiply the duration of the study times the weight times the propofol dose at 250, and that should give you the amount that you need to have in your syringe so that you are not having to go back in and out of the MRI room to refill the propofol drip. So for example, if your patient is 10 kilos and the scanner is going to be for 1 hour, so you do 10 kilos times 60 minutes times 250, and then you will get the amount that you need to have in your syringe for that time. Followed by placing the monitors, placing the nasal cannula, placing the pulse ox and temp probe, and then we are ready to go. During MRI, if it's MRI with contrast, you want to make sure, especially if you're taking care of a kiddo that's like 5 kilos, 3 kilos, and a bolus of 10 to 20 milligrams of propofol is going to cause them to go apneic. You want to be careful where you inject the medication, and I think this just goes for any pediatric case where it's important where you inject the medication. So if you're supposed to give contrast for little babies like that especially, then try to administer the medication at the hub of the IV so that you are not bolusing the patient with the amount that's in the tubing that has to go through in order to get to the patient. So that's just something to keep in mind. So yeah, that's what I wanted to share. Thank you so much for tuning in.